Hi guys, how are you doing? Welcome back to my channel. For those who are new, welcome. For those who always watch my videos, thank you so much for always watching my videos, of course. And yeah, so my name is Sharon, and today I promised to do a video about how you can reduce your blood pressure through lifestyle modification. I started the blood pressure series 2 weeks ago, and if you've not watched my previous videos, kindly go and watch them. You'll have a better understanding of the condition. You'll also learn how you can be able to monitor your condition at home. And today I just want to give you some of the things that you can do to adapt a new lifestyle that will actually help reduce your blood pressure and eventually get you off medication. So the first and very important way how you can be able to reduce your blood pressure through lifestyle modification is diet and things. So for blood pressure patients, we normally have a special diet for them that's known as DASH diet. DASH is an acronym which basically stands for Dietary Approaches to Stop Hypertension. So this is normally a diet where we advise our patients to reduce their sodium intake. Sodium is basically salt, and also we advise them to take foods that are rich in certain nutrients like whole grains. We also advise them to increase their fruits and vegetable portions in their diet, and also to reduce and stop taking junk and processed foods. So normally the salt intake should be less than 2,300 milligrams of salt, which is actually equivalent to a teaspoon of salt. So ensure that you do not exceed more than a teaspoon of salt. Ensure you put enough salt in your food while cooking it so that you don't have to add salt. And remember, there's no special salt. So Himalayan salt, sea salt, all of them, they're made in the same way. So reduce that, and yeah, you'll be able to reduce your blood pressure. Actually, it is said that reducing your salt intake can cause a tremendous drop in your blood pressure equivalent to 1 or 2 medications. So kindly make sure whether you have blood pressure, high blood pressure or not, I would advise you to actually reduce your salt intake. This will help you to actually live a very healthy lifestyle. Again, under diet, I'll just show you how a healthy plate should look like. A healthy plate, assuming that it's a full circle, half of that plate should be filled with fruits and vegetables, low fat fruits and vegetables. A quarter of it should be filled with whole grains, and then the other part should be filled with proteins, healthy proteins, of course. Another thing about diet is that there are certain foods that can actually help reduce your blood pressure. Some of these foods include foods like celery. Celery is very good. It's anti-inflammatory and it also reduces your blood pressure. You can take it as a smoothie. You can take it as whole the way it is. You can take it in your salad. However you wish to take it, it's edible anyway. Carrot is also good. It lowers your blood pressure and it's also anti-inflammatory. Chia seeds are small black seeds that normally have been shown to have very good effects. It boosts your immunity, it reduces your blood pressure, it also helps you control arthritis and diabetes. So it has been shown to have some very good effects. So I would advise, if you can be able to get them, they are found in food stores or the supermarket. You can put it in your water and drink it throughout the day. You can also put it in your cereal in the morning, in breakfast, or just find a way to include it in your diet, however suitable it fits for you. Flax seeds, also you can get them in food stores. They've also been shown to have a very good effect on blood pressure patients. It reduces your blood pressure tremendously. Certain things also like hibiscus. Hibiscus is a plant, and normally the best way I would advise patients to get it is through taking it as hibiscus tea. There are tea bags that are specifically written hibiscus. So instead of taking your normal tea bags, you can start taking hibiscus tea. It has been shown to actually reduce your blood pressure by about 2 to 3 millimeters of mercury. That's very impressive. Then another supplement of food that has been shown to have a very positive effect on blood pressure patients is garlic. Garlic is basically kitungu saumu for people who speak Kiswahili. You can either put it in your food, you can take it as a whole, you can put it in your drink, or you can also put it as a spice in your food. It has been shown to have very good effects. It's anti-inflammatory, it reduces your blood pressure, and that is exactly the kind of effect that we are looking for. Another thing that can really be helpful is fish oil. Fish oil normally has omega H3, and this is a very good supplement because it actually reduces your cholesterol levels and reduces your blood pressure. So some of these things are available. They are very much available out there. You only need to go and be very intentional about getting these things for the purpose of your health. Tomatoes are also very good. Tomatoes have been shown to, they are antioxidants, very good for cancer patients, very good for patients who have cholesterol, very good anti-inflammatory agent, and it also reduces your blood pressure. So it's very good. It's good if you can take it as whole or incorporate it in your diet, but either way, tomatoes have been shown to have a really positive effect. The second point I would want to advise patients is about exercise. Exercise normally improves your heart function because it makes your heart stronger. When your heart is strong, it will pump blood more effectively because it will reduce the pressure at which it pumps blood from the heart to the rest of your body. Normally, when your heart is weak and it's training, it pumps blood with a lot of pressure. So basically, anything that increases your heart rate is good for your body. And when I talk about exercise, I don't mean going to the gym and lifting 100 kilograms. You can start by little things that you do every day. For example, house chores is a very good form of exercise. Some vigorous house chores, you can do that 20 to 30 minutes every day. It's very good. You can do some dancing, very good. Cycling can also increase your heart rate. It's also a very good form of exercise. You can do jogging, you can walk, you can play your favorite sport. Basically, just anything that will increase your heart rate. You can also go to the gym, do some aerobic exercises. And nowadays, you can do exercises even at the comfort of your home. You just need music, you need a trainer maybe online, and yeah, that's all that you need. Some of these things are very accessible even on YouTube. When you just Google aerobic exercises, you can get so many that you can be able to adapt to. Dancing like Zumba, it's very good because it increases your heart rate. When your heart rate is increased, it makes your heart healthier and stronger, and this will enable you to pump blood with less pressure. Another way that I forgot to mention is about exercises is simple things like also taking the stairs instead of using a lift. Don't use the lift, use the stairs. It's a very healthy form of exercise because it will increase your heart rate, which will actually help your heart to be healthier and stronger. My third point, which is actually very closely related to diet and exercise, is weight loss, because eventually when you adapt a healthy diet and when you exercise, you'll end up losing weight. Increased weight actually increases your blood pressure, and it actually causes other conditions like heart disease, stroke, and also cholesterol. It increases your cholesterol, which can actually bring other problems. So the first thing I would advise is that get your weight right, adapt these things, exercise, eat right, and you'll find yourself actually losing weight. Research has shown that reducing your weight tremendously can reduce your blood pressure by about 5 to 20 millimeters of mercury. Remember, this is equivalent to around 2 to 3 drugs, and therefore it's very important to be able to do that. Another thing is about sleep. In my previous video, I said that sleep deprivation actually increases your blood pressure because when you lack sleep, you're very irritable. You have a lot of anxiety that is stuffed in you. So normally for adults, we advise them to get about 7 to 9 hours of sleep every day. Force yourself to sleep. Do some meditation, anything just to calm you down and to enable you to sleep. You can be able to do that. If you have insomnia, kindly talk to your healthcare provider. They'll be able to direct you and to give you further directions from there. Something else that is also related kind of to sleep is just about reducing your stress. Normally, when we are stressed, our body releases stress hormones. One of the stress hormones that our body releases is cortisol. It causes an increase in weight gain. And remember, what we do not want is gaining weight because we are trying to lose as much weight as possible. So another hormone that is normally released when your body is under stress is known as adrenaline. adrenaline normally is a vasoconstrictor, and therefore what it does is that it reduces the size of your blood vessels, and this will cause blood to be pumped under a high pressure, and this is what we're trying to avoid, because this is eventually what causes blood pressure. And I'll just give you a few tips how you can effectively be able to reduce your stress. One of the ways is by limiting the demands in your life, because this can actually cause you to get overwhelmed. Another way is by learning to say no, because there are certain things that we do that actually we have a choice of saying no to. One other way is by actually getting enough sleep, because I talked about sleep causing, when you lack sleep, you actually get anxiety. So reducing your sleep, getting enough sleep is very important. Another way is focusing on the things that you can, focusing on things that you have control over, and just getting your mind off the things that you do not have control over. Another way that you can actually reduce stress is through doing meditation and relaxation exercises. You can take deep breaths, they really calm you down, and this will be very important for you. This will actually help you reduce your stress levels, which will eventually have a positive impact on your blood pressure readings. To my last point, which is about habits, I just want to I want to call them bad habits, because they've not been shown to have any positive impact. Smoking has no benefit to your body at all. There have been no benefits that smoking has shown to cause, and therefore I would advise anyone who has blood pressure and is a chronic smoker, kindly stop smoking, because it actually has no positive impact. And actually, smoking increases blood pressure, it increases your chances of getting heart disease, it also increases your chance of getting lung disease and eventually lung cancer. So I would advise patients to just quit smoking, find a way and just stop smoking. Seek help from where you can. Another thing is, I would advise patients to actually reduce alcohol. Actually, the guidelines, the BP guidelines normally say that women should not take more than a beer per day and men should not take more than 2 beers per day. But if you're in a position to completely stop taking alcohol, especially if you're really struggling with your blood pressure, it will tremendously cause a decrease in your blood pressure by about actually 2 to 3 millimeters of mercury, which is actually equivalent to 1 blood pressure medicine. And one thing that I actually forgot to talk about is coffee. Taking more than 4 cups of coffee actually increases your blood pressure. Reduce your coffee intake to about a minimum of 2 cups, which is actually important, because taking too many cups of coffee can actually cause you to actually have chronic hypertension, which is something that we are avoiding. So remember that all these points that I've been able to say, these are things that are not only recommended to blood pressure patients. If you have any condition, any lifestyle condition, any terminal illness, or even if you're healthy, these are things that can actually help you to maintain your healthy status and to prevent some of these lifestyle conditions like blood pressure, diabetes, etc. So I would advise you to take up some of these lifestyle recommendations that I've done: eating healthy, reducing your salt intake, taking certain supplements, and exercising, reducing your weight. All these things are important. Sleeping enough, reducing your stress, stopping the bad habits of smoking and drinking. All these things are very, very advisable, even if you're healthy. And I would advise you to share this video with your friends and family. Share it with your parents, because most of our parents are in that age where they are managing some of these conditions, and even if they are not, you can share this with them, because it will help them to actually live longer and maintain a healthy lifestyle. Thank you for hanging out with me. Thank you for always watching my videos. Kindly consider subscribing to this channel. We have very good videos in this channel. You can actually be able to go and watch some of the previous videos. You'll learn a lot and you'll also be entertained. Yes. So see you next time.